All right, here we are in chapter 21. In this chapter, we're going to talk about nutritional support and intravenous therapy or IV therapy. These are two essential ways that the healthcare team helps residents who can't meet their nutritional needs or their fluid needs by eating or drinking alone. As CNAs, your role is to never start, regulate, or give feedings or IV fluids. But your role is crucial in keeping residents safe and comfortable while monitoring for changes. By the end of this lesson, you're going to understand what to look for, what to report, and how to preserve each resident's dignity and quality of life. Think of this chapter as answering one big question: how can we safely support the body when the mouth isn't an option? So, poor nutrition results when residents can't ingest enough food or fluid. Aspiration, as we've talked about before, is a risk. So, aspiration again is the breathing in of food, fluid, or vomitus, or an object into the lungs. So, common causes can be cancer of the head, the neck, and the esophagus, trauma to the face, the mouth, the head, or the neck, a coma, dysphagia, dementia, sometimes eating disorders, nervous system disorders. Some people have prolonged vomiting, major surgery or trauma, as well as illness or disorders that affect eating and nutrition. So, to help residents get the nutrients that they need while they have issues eating, medical staff use different ways to get them these nutritional requirements. So, gavage is the process of giving tube feedings. So, tube feedings supplement or replace normal nutrition. Enteral nutrition means feeding through the GI tract or the gastrointestinal tract, and this is via a feeding tube. This might be an NG tube or a nasogastric tube. That means a naso as in nose, so nose gastric tube, nasogastric tube, and that goes into the stomach. You can see an image of that in figure 21.1, or a gastrostomy tube. Again, that's a gastrostomy tube, or a G tube is the other name for that, or an abbreviation for that, and that's figure 21.3. And this is placed directly into the stomach. It's a port that you will see sometimes in an abdomen. Also, there's the jejunostomy or a J tube. You'll see that in figure 21.4, and that goes into the small intestine. So feeding tubes and feeding that is given through those tubes provides a balanced formula with all necessary nutrients. And this is delivered either in scheduled bolus feedings or continuous drips. So a bolus feeding is, say, for example, somebody has an order for 200 mLs of food to be given at, say, noon, and another bolus of 200 mLs to be given at, say, for example, 2 p.m. or 1400, or a continuous drip. And sometimes continuous drips are, programmed for say, I don't know, 100 mLs per hour. And then there's typically a water flush of a couple of mils every hour as well. So they're getting what would be equivalent of food as well as a drink. So your job is to comfort and to observe. Also, you're going to provide oral hygiene to keep the mouth clean and moist. You're going to make sure that the tubing isn't pulled or kinked, and you're going to report anything that seems unusual. You might see some coughing, some gagging, or formula leaking around the tube. And if those are things that you see, you need to report those immediately. Check out figure 21.1 in your textbook, and you're going to see examples of NG tubes, PEG tubes, and J tubes. So safety is everything with tube feedings. So aspiration, again, the food or fluid entering the lungs, that is one of the biggest risks with tube feedings. And so here's how you can prevent it. So you're always going to keep the head of the bed raised at least 30 degrees during and for 1 hour after feedings. Never reposition or flush the tube. That is the nurse's job. And if a resident starts coughing or choking or vomiting, stop what you're doing and alert the nurse immediately. You're also going to help by keeping that area clean. Check that the tubing isn't looped under the body and ensure that the resident's gown and the linens stay dry. And that's just keeping an eye out to make sure if things are leaking, A, you need to let the nurse know, and then B, also making sure that there's not any moisture accumulating to cause some skin breakdown. So here's your ticket to class question. If you notice a resident with a feeding tube suddenly start coughing and their face turns red, what is your first action as a CNA? So sometimes the digestive system can't be used at all, and maybe this is after a major bowel surgery or when the GI or the gastrointestinal tract isn't functioning properly. And that's when we use parenteral nutrition, and it means beyond the gut feeding. So parenteral feeding means beyond the gut feeding. And this type of nutrition is often called TPN for total parenteral nutrition. And this goes directly into the bloodstream through a central IV line. This is sterile, it's precise, and it is closely monitored by nurses and dietitians. Nurses just recently had a new update that two nurses need to verify the administration of this type of nutrition. So when it is started, two nurses need to be verifying the orders while looking at the IV pump and verifying that it's programmed properly. So that's how closely monitored this is. You can check out figure 21.9 so for information. So TPN risks include infection, fluid imbalances, blood sugar imbalances also. Again, your role is going to be focusing on observation and comfort. So we're going to provide frequent oral care for residents who are NPO. And remember, that means that they're not taking anything orally. And this includes lubricant to the lips. You can use some chapstick. We do have tubes of chapstick in our supply rooms. Mouth rinses as the nurse and the care plan direct. So you're going to keep lips and mouth moist with lubricants or rinses. You also are going to be looking for signs of fever, swelling, shortness of air, or chest pain. If you notice these right away, that can signal an infection, or it might be signaling a fluid imbalance, and that's why it's important to let the nurse know. See box 21.1 in the textbook for a list of TPN complications that you need to be reporting to the nurses you are working with. So IV therapy or intravenous therapy, this is delivering fluids, nutrients, or medications directly to a vein. You can check this out in figure 21.10 or 2110. CNAs never start, they never maintain or regulate an IV. You might have some responsibilities surrounding it though. So RNs start and maintain the infusion according to doctor's orders. RNs also give IV drugs and administer blood through the IV. So you're going to observe that site. If you're up ambulating someone, if you're in there turning someone, if you're helping somebody feed, you can check out that site. Keep an eye on it. You can check the tubing and also the resident's comfort. So if you see redness, swelling, or fluid leaking around the site, please let your nurse know right away. If the patient is complaining of pain or burning, please let your nurse know right away. Some medications do burn when they go in. Potassium is one of those that does that. Let your nurse know. It can irritate the inside of the vein. There are things that the nurses can do in order to alleviate that pain. If you see blood in the tubing or wet dressings, it could be wet from the IV medication or fluids that is given because it's leaking, or it could be leaking outside of and around, or bleeding outside and around from that IV site. So let the nurse know. Other one to know is alarm sounding from an IV pump. As a CNA, you do not touch pumps. Doctors should not also be touching pumps. I've had an instance where I've had an MD student in with a patient and silence a pump when it was going off, and I found out later that's not their job. Those are my jobs to be maintaining those. And so if a pump is alarming, what do? You let the nurse know. You also protect the tubing during bathing, during dressing or repositioning. There's special coverings that we can put over IV sites to keep them in when we are bathing our patients or in our residents. We're also going to help our residents walk, making sure that that IV pull moves smoothly with them and that the tubing doesn't get stretched or it doesn't get caught. So let's look closer at IV equipment. This includes the solution bag, the drip chamber, the tubing clamp, and the catheter or the needle that goes into the vein. So the IV bag hangs from a pole or a pump stand. The flow rate is the speed at which the fluid enters the body, and this is controlled by the pump. The CNA is not manipulating or changing anything to do with that IV pump. The doctor orders the amount of fluid to be given or infused, as well as the amount of time that's to be given in. The nurses are following those orders. So with this information, the nurse can figure out the flow rate. We use med math in order to figure that out. Sometimes you might see an abbreviation GTT. That is the abbreviation for drops, and that is from a Latin term. Just so you know, GTT means drops. So as a CNA, it's your responsibility to observe and report if no fluid appears to be dripping. That said, some drips are incredibly slow. So some, for example, you might be giving Lasix is going in IV for a patient, and that typically is a very slow drip. But if you look at it and you don't understand why it's not moving, by all means, please say something to your nurse. If the pump alarm is sounding, you let the nurse know. You do not silence that alarm. You do not turn the pump off. That is the nursing job. And if the tubing looks kinked or disconnected, also please let the nurse know. Figure 21.15 in your textbook will give you a clear picture of how pumps and clamps control flow. If you have any further questions on that, please feel free to ask and we can look at that closer in class. As a CNA, you're going to help meet safety, hygiene, and activity needs of a person with an IV. When help with mobility or turning, always move the IV bag to the same side of the bed as the arm with the line and make sure that the tubing has enough slack to avoid pulling or dislodging it. There are measures for IV therapy in box 21.1 in your textbook, and you're welcome to check those out. So what's the big picture role here? What's your big picture role as a CNA here? Again, you are the eyes and the ears of the nurse. You can protect tubing during repositioning, bathing, and dressing. You also are going to be reporting leaks, swelling, redness, or site pain right away. Provide comfort. Support that arm with a pillow. Check the IV pole. Make sure that the tubing doesn't tug when you're moving a patient. Support with dignity. And you can explain in simple terms, in simple reassuring terms and language what's happening to the patient, to the resident, and also remember that you are an important advocate. So if you see something that seems unsafe, even if it's subtle, by all means speak up. And as you gain experience, these safety observations are going to become second nature. You're going to recognize what's normal and what's not normal, but it's important to ask questions because that will help you tease out what is happening and should be happening versus what is happening and should not be happening. So nutrition support, whether it is through an IV or a tube, it isn't just about calories and hydration. This is aiming at maintaining strength, building health, and also providing comfort when somebody can't eat in the usual way. So caring for persons needing nutritional support or IV therapy may be great, and they can take a lot of time, but don't take shortcuts and don't neglect care just because it's going to take a bunch of time. Doing so is unethical, and it can cause somebody some great harm. The person or the family after once they're done talking to the doctor, they might decide to stop nutritional or IV support therapy. You might agree or you might disagree with those choices, but those aren't your choices to make. So you need to make sure that you remain supportive of the decisions that the resident or the patient is making. Sometimes choices that folks make might not be within your religious or your cultural beliefs or your values, but these are the person's wishes, these are the family's wishes, and these are the doctor's orders, and they need to be followed. If you have problems with the decision, the nurse might need to change your assignment. We talked about this on your first day. Have those conversations with your nurses, have those conversations with your charge nurse, and just be open and clear and honest about how you're feeling and what it is that you're seeing. As you care for these patients who are getting nutritional support through IV or tube therapy, make sure you do oral cares, moisten the lips, position the resident comfortably, and make sure that they have privacy during care. We're going to protect dignity and well-being at all times. So for your reflection question, what is one small action you can take during your shift that supports both the comfort and a sense of dignity of an individual who is receiving tube feeds and or IV therapy? I look forward to your responses and discussing these a bit more in class. Thank you.